Hi, everyone. For those of you who've just joined us, welcome again to the session on what you didn't know about public health. So, we're going to start, and our first speaker for today is Dr. Rainer Tan, who is a assistant professor at the Salisbury Hart School of Public Health. He leads the Courage Lab, where his work focuses on understanding and addressing stigma, strengthening community engagement, and advancing health equity. He's trained as an implementation and socio-behavioral scientist. He works closely with communities to translate research into practical and meaningful action. Beyond academia, he is deeply involved in community and policy work. He is the head of research at the Greenhouse Community Services Limited and treasurer of the Society for Behavioral Health. He also co-leads SG Mental Health Matters and Project Hayat, a community-led initiative contributing to Singapore's national suicide prevention efforts. And he also represents community perspectives on the Agency of Care Effectiveness Consumer Panel. So Dr. Reno will be sharing on bridging communities and science, translating lived experience to public health. I'll pass the time to Dr. Reno now.
Thank you so much, Danesh, for the very kind introduction. Yeah, I just want to point out also Danesh works in my team, and it's a very wonderful student. Alongside, you'll meet Daniel also. So, I'm very grateful to be working with such passionate individuals too. I will keep my sharing short today, but I just wanted to maybe share a little bit more about the possibilities of the kind of impact that we can make in public health, right? And I'm sure Dr. Raymond later on will share with you, like traditionally where like people who have trained in public health or do have a bit of a education in public health tend to land in terms of career prospects. But I also wanted to show maybe, like what are the possibilities, right, for what public health can do. And I think a lot of the work that I do tends to bridge, what we see as like communities out there that we serve, and also the science that comes with public health research also, or research or practice. So I wanted to maybe start off a little bit about myself, just to, like maybe share a bit more about my journey into public health. Many of you will be taking your degrees in, we don't have a degree or like in public health, right? I think a bachelor's of public health, is something that you would take on as a major, a second major, or like a minor. This is something that is important to note. I think it also reflects my own experience, right? So, I started out as a business school student back at SMU, and actually, I wanted to be a pastry chef. I wanted to be in the F&B industry. And I mean, these are some pictures of my time back then. I was more interested in other things. So, like, we've got like some photos here to document that. I won't go into too much detail here, but I think life circumstances change. I share quite openly about my own mental health challenges. Like I've been to rehabilitation myself, drug rehabilitation, and that was a life-changing moment for me. And I remember back in rehab, the thing that really stood out to me was, this person does such cool work, right? Around like psychology. That was the first time I heard of what mental health was. That was the first time I actually saw a therapist. And when I came out of rehab, which, I dropped out of school for, I wanted to be a psychologist. And when I went back to Singapore, I wrote into SMU to re-enroll. So I actually switched from I started business school in 2009 for a bachelor's of business management. I dropped out in 2012, and then I re-admitted at SMU for my bachelor's in 2013, but I this time pursued a bachelor's of social science. And I eventually ended up doing sociology as my main major and degree. We had opportunities to do second majors then, but I knew for a fact that I really wanted to be a sociologist. And that's where my interest in things like, for example, research started to grow. I did my senior thesis in sociology, and this is something that all of you as NUS students would also probably do as part of your own graduation requirements, right? Maybe a undergraduate thesis or honors thesis, and you do your own research. That's when I started to realize, my love for doing research, and also not just research in certain concepts, like for example, stigma. But my love for research was also attached to, how can I make research relevant to impact, and how can I make lives better through my research. I think many of you might also grapple with, there are many different pathways on making impact on the world. And I found along the way that, this is something that I really enjoyed doing, as well as, potentially being able to sort of create change. Right. From there, I wanted to also show that, um, you know, for public health, one of the strengths is that we rely on, everyone who has had training in many different disciplines, be it in the social sciences, be it in business management. You can also be in medicine, you can be in, like a geography, like what we do in public health is you then tend to apply your basic training, towards health issues or health outcomes. And I think that's a very exciting thing about public health because all my colleagues are doing very exciting work, perhaps potentially on the same topics like diabetes, like mental health. But we all bring along with us our different perspectives that we have gained from our own, maybe like undergraduate training or our own basic degrees. So my journey has been through that, and I've been trained along the way in all these different areas. What do I teach here in the public health school? Because of my own training and interest in sociology, in mental health, therefore, a lot of the courses that I teach here focus on that. In the undergraduate course curriculum, I guest lecture on mental health. In the postgraduate course curriculum, I do stuff on public health policies, programs, and as a social scientist or sociologist, I have a strong interest in human experience and their stories, right? And so I teach research methods on qualitative research methods, which is focused on how do we make sense of human experience and stories for robust research, and also how do we then take the social science theories that we learn in the social sciences and apply them to strengthen our understanding of public health. And at this point, you might be wondering, okay, like this sounds very academic, it sounds very researchy. How does this then actually translate into actual impact for people, right? And one thing that I wanted to share also is, I've grappled with that question quite a bit in my work. And one thing that has sort of grounded me throughout the work that I do in the School of Public Health is, being able to make sure that I have a foot in different community groups as well. Because, I want my research to be answerable and accountable to some of the needs of different communities here in Singapore. And throughout the last few years, and I still do it now. I help lead the research at the Greenhouse, which is a substance use recovery charity here in Singapore. Also with Project X, which serves health and social needs of sex workers in Singapore, and I also co-lead SG Mental Health Matters, which is a ground up community-led initiative to address mental health policy related issues in Singapore as well. And the research that I've done and has always been sort of grounded in what does the community need or what are some of the gaps in these different areas. And maybe the question here is, when I do research, how do I know what kind of research is going to be impactful? I always ask the communities, on what they think might be impactful also. And I match that with what is missing in the literature or the science out there. The greenhouse is something that does drug use recovery. I found a place to do that kind of research to sort of, inform programs because with a new charity being set up, this is something where, maybe we might be thinking about what kind of services do we provide? How do we make sure that our services are effective? And, the kind of research and the work that we do in public health addresses these things. Making sure that the services or the interventions are actually scientific, they're evidence-based. And more than that, once we start rolling them out, are they actually effective in, meeting our goals, right? And, this is the kind of work that I do in terms of maybe talking to potential beneficiaries, talking to potential, like people who are receiving services, understanding their stories. And, like, for example, with substance use recovery, we find that, like early childhood trauma is something that, drives addiction, in people. And therefore, a lot of the services that we provide at the center, are based on these models of care where we address not just the substance use, but also people's trauma. We provide trauma-informed care. And the research here actually allows us to make sure that we do things in a scientific or evidence-based way. Like I think I've also helped some research in communities like Action for AIDS. I think one of the interesting things is we've seen how a lot of community kinds of interventions or programs. Like this was Emmy-nominated video, right, that was sort of promoting HIV and sexually transmitted infectious testing in the community. But then, as a researcher, I was like, oh, does this actually work? Because some of the programs and the interventions might be done without the actual evaluation. And so, part of my PhD was also looking at how do I design a study to prove that something that has been developed by the community actually has an impact. And this was something that I did for my own research during COVID-19, one of the exciting things that happened was also, like even though, we had the lockdowns, and actually one thing that came up was, what about the different groups in society that, might not be, people, we might not have a good, hold on, keeping tabs on them. We're not so sure about the movements of certain groups, and sex workers was one of them. And so during the COVID-19 pandemic, with my mentor, Dr. Wong Milian, and myself, we did some work in the sex work community to find out more about, how COVID-19 has been impacting the community. And, these are all things that, are not just research, right? We actually go into communities to understand people, understand, how we can actually better our programs and our services to make sure that everyone is healthy in Singapore and beyond. With SG Mental Health Matters, we do a lot of mental health policy kind of work in the community, helping people better understand, how mental health policy is developed in Singapore. And more than that, we also have for example, Project Hyatt, which was our national suicide prevention strategy that we launched back in 2024. And this was sort of our way of pulling together communities to chart the direction for suicide prevention in Singapore. So you can see that beyond just research, right, we actually take action and we mobilize different communities to also look at what's important for us to address in the community. How can we support policymakers? How can we support the government in addressing areas of need in Singapore? And suicide prevention was one of those areas that we found there was a need to do this. Beyond this suicide prevention strategy, Project Hyatt, we often, move on to really thinking about how communities experience different kinds of mental health policies in Singapore. And, if you want to find out more, and in the interest of time, I won't cover it today, but SG Mental Health Matters, does a lot of public health related work and research, and you can find out more about the work that we do over there. And this all also ties into the work that I do with the school, right? As someone who is an assistant professor here, we do the research, but also we get undergraduates, for example, like Tanesh, whom you have seen, Daniel, who you'll see later. I had taught them when they were undergraduates, or I had mentored them, and or rather Daniel was still an undergraduate, So, these are the opportunities where we work together to actually advance different issues around public health in Singapore. The last bit over here that I will cover is, then what kind of impact are we actually making here at the school? Or, maybe I wouldn't be so presumptuous about the rest of the school, but, what kind of impact do I actually see in my own work here, which I believe is something that many of us here in public health are also trying to do in terms of the impact of our work. You know, I think one thing that, working with communities, I always learn different principles of how to do research. A lot of it involves that mutual ownership of the research. Once we do research with different communities, how can we then work with communities to really ensure that, the research or the kinds of stuff that we do here in public health has an impact. And, part of that also is making sure that there is that science communication, right? That what we do in terms of, articulating or finding out the different problems, in terms of, evaluating the types of the effectiveness of interventions, in terms of, let's say, evaluating different programs, we have to communicate that, right, to people to say that this works, this should be sustained, this should be scaled up. And, I think a lot of that work, doesn't involve research traditionally. It might involve a lot of media engagement. It might involve a lot of, like advocacy at a parliamentary level. And this is some things that, I've tried to do in my own work. So, like being able to, like not everyone reads like a research article, but I think being able to communicate these things through the media, to advance policy, to help educate the public is something that, the public health school also does quite a lot as well, right? So these are some of the different commentaries around sexual health. I think this was one of the I think one of my favorite moments over here that I like to show. Said this earlier, but basically, I think it's kind of nice to, I guess, have your name be mentioned in Parliament. Then your research, right, in advancing policy. So this is a screen grab of, when some of the research that I did was, mentioned in Parliament for, the I guess Infectious Diseases Act amendment back in 2023. And this was, I think a moment where I'm like, okay, the kind of work that I do, I love seeing how it can make changes to policy at that level. I won't go into too much detail here, like in the interest of time. But I think generally the work that we do here doesn't just stay in research, doesn't just stay in the institution, in academia, but we bring it out to the communities to make change for, like health for our population here. And I think if you decide to join us, and learn more and be part of the NUS, Saucy Hawk School of Public Health community, you'll be able to see some of the amazing work that many of the faculty and the people here do, to better the health of Singaporeans and also the region and the world, really. Um, but yeah, I just wanted to end off by acknowledging my team. Some of them you'll see in this seminar. Some of them are not pictured here. But this is the work that we collectively do here at my lab. And yeah, thanks so much for your time today. I'm going to pass it on to the next presenter. Thank you.
Okay, thank you, Dr. Rayner. So next we'll have Dr. Raymond Lim, who will be sharing on why study public health. Dr. Raymond is a public health physician and senior lecturer at the Saucy Hawk School of Public Health. As the domain leader for social and behavioral sciences, he also leads our second major and minor and public health programs and works closely with students to help them understand how behavior, communication, and everyday choices influence health. His research and teachings span behavioral sciences, evaluation of public health programs, and workplace health promotion. He's especially interested in applying evidence from mixed methods and qualitative research to improve how public health programs are designed, delivered, and evaluated in real-world settings. So I'll pass the time to Dr. Raymond now. Dr. Raymond, please.
Thank you, Dinesh, for the kind introduction. Please give me some time to share the slides. Okay, good evening, everyone, and welcome to the online NUS Open House. I would like to kickstart the session by giving an overview of what is public health. Hopefully, this can help to clarify some of the misconceptions surrounding public health and give you some insights into what public health professionals do. I will ask a few questions. Not to worry, these are not the questions for the NUS entrance examination, but would probably trigger you to think more in depth as to what really constitutes public health. First, does public health encompass the control of disease and promotion of health through sanitation to ensure a healthy and clean environment? For example, around 500 BC, the ancient Greeks and Romans have already begun actively practicing community sanitation measures. Or is it the role of public health to prepare for disaster response, both for natural disasters as well as human-made threats? Or is it the role of public health to prevent and control the various risk factors of chronic diseases, such as unhealthy diet, physical inactivity, sedentary behavior, and smoking? Or is it public health role to prevent and control the various outbreaks and epidemics arising from novel and emerging infectious disease? If your answer is yes to all of the above, I congratulate you on appreciating the broad spectrum of public health work. If your answer is no to any of the above, then all the more I encourage you to stay on for this talk so that I can help to clear up your misconceptions. It is timely now for me to refer you to the definition of public health given by Professor Charles Edward Winslow, who was actually a highly regarded American public health expert. His definition of public health remains highly relevant till today. He defined public health as the science and the art of preventing disease, prolonging life, and promoting health through the organized efforts of the society. This is in contrast to clinical medicine, which focus on the individual patient and treatment. But for public health, as you have heard from Dr. Reno Tan, the focus is more on prevention, which is always better than cure, and is on improving community and population health. How about now we take a look at the public health scene in Singapore. In Singapore, public health professionals work in various capacities and roles. They function as executive, manager, director positions in various settings, such as healthcare-related statutory boards, governmental agencies, ministries, hospital operations and affairs, healthcare, human resource and finance, community health, and the regional healthcare systems. They implement public health and health promotion programs, develop health policies, administer services, conduct research, and regulate health systems to improve community health. The scope of public health is indeed very broad, particularly in today's context. Taking obesity as an example, it is not only a global public health problem, it also affects Singapore. Obesity is influenced by a diverse range of factors, all the way from individual lifestyle factor to upstream factors, including food and physical activity environment, policy settings, and the economic systems. Tackling this public health issue therefore requires action by various parties and stakeholders. Public health related work in this area could range from educating the population on healthy eating habits, designing and changing the environment to increase population physical activity level, to working with stakeholders such as the food industry to develop healthier food products, all the way to creating and evaluating healthcare financing policies. Given the wide range of public health work, the field is indeed multidisciplinary in nature. It is therefore not surprising that modern public health practice requires professionals from different backgrounds. And these diverse disciplines, which are not exhaustive, include life science, psychology, sociology, geography, social work, economics, communications and new media, computing, engineering, architecture, business, and many, many others. And these disciplines are also the first major of most of NUS students. And therefore, public health has a second major or a minor will be highly relevant and will complement most of NUS students' first major. Importantly, it will also open up another route of employment for you when you graduate. So, why would you, as a prospective NUS student, be interested to enroll in our public health educational programs? Now, we posed this question to our students through a study, and we found that there were 5 top reasons for them doing so. Check out these reasons to see whether they apply to you too. So among those who were keen, a quarter felt that public health courses were interesting. Another quarter felt that it is highly relevant in today's context. Especially, we know that for Singapore, we are grappling with an aging population, and many of the health problems that we see, they actually have a social and behavioral dimension to it. And 1/5 of them hope to obtain more comprehensive training in public health, and another 1/5 of them cited the prospects of securing a job in the field of public health or healthcare sector. The last 1/10 of the students who were surveyed felt that it would be complementary to their current first major. The Socio School of Public Health is the only national school of public health in Singapore. We currently offer the second major and minor programs in public health. And I showcase here the program objectives. The minor allows students to appreciate the multidisciplinary role of public health in the prevention of diseases as well as to improve the health of communities. The second major is designed to complement students' first major. Particularly, we want to groom our students with soft skills and perspective so that they're able to function effectively as public health professionals or in public health teams. Students who graduate from the program with the knowledge and the approaches needed, they can then be able to address today's public health challenges and improve community health. Ever since the launch of the minor in public health by our school, the enrollment has exceeded more than 300 in recent years. In fact, it is currently one of the most popular minor programs at NUS. For our second major program, enrollment is increasing, and it has been recently converted into an open program. For the evaluation of the minor program, we see that student feedback has been largely positive. Has seen students found that our lecturers are passionate about the fields that they are leading, and the program broadens their career opportunities because it is recognized by the public health employers and our industry stakeholders out there. As of 2025, we have about 844 NUS graduates with a minor in public health, and the numbers are still increasing. If we look at for the second major program, as of 2025, we have about 55 NUS graduates with a second major in public health, and the numbers are still increasing. So a very important question that comes to your mind right now would be, so where do students who receive public health education in the university find employment? I believe this is one of the commonly asked questions, right, that you have in your mind. And we also do see a question in the Q&A. So we show you here the various settings. And I just want to emphasize that this is not exhaustive because the role of public health professionals are increasing. The first group would be the international public health related organizations. The second group would be the ministries and the various governmental agencies, including the statutory boards. The third group would be the public and private healthcare organizations, including the various hospitals that you see here. The fourth group would be the non-governmental organizations and foundations. And the fifth group would be the pharmaceutical organizations and companies. Now, a key question that will also come to your mind is, could I try a few courses now to see whether public health indeed suits me after I have successfully enrolled in NUS? Yes, definitely, which is why I'm going to showcase here some courses which might be of interest to you. First, we offer general education courses where NUS students could choose to fulfill their general education requirements. This is the Public Health in Action course that is offered by our school. From the global increase in obesity to COVID-19, the course aims to examine a range of health issues and solutions so that we can explore different contexts throughout the world. And students will get a chance to work in small groups where they could debate and evaluate paths to addressing global and key public health issues in a variety of social cultural contexts. And we believe this course would allow students to develop an appreciation of how complex public health solutions and problems can be in terms of prevention, and then developing the appropriate, culturally appropriate ecological solutions to it. These are the feedback from the course itself. As can be seen, students like the exposure to a wide variety of topics and that they have learned how public health can be actually implemented in many other sectors. We do also offer courses in the special term, which might be of interest to students during the vacation period. So an example would be the course on health equity, global insights, and Asian applications. The course introduced students to global public health with a focus on health issues among the low and middle income countries in Asia. Now, the key issues explored by the course include the following. What are the priority health issues that dominate the global health agenda today? What are the societal factors that determine disease burden and adverse health outcomes in the low and middle income countries in Asia? What are the community healthcare system and policy levers that are available to reduce this disparity? So as can be seen, this is an experiential learning course which involves a trip overseas to one of the low and middle income countries in Asia, where students get to learn from the various public healthcare experts, as well as get to tour the healthcare facilities and the public health infrastructures and healthcare systems and in the institutions right in the particular country itself. These are the feedback from the course and can be seen. Students found the course to be an eye-opener because they learn not just about the healthcare and the health systems, but more importantly, they appreciate the social economic issues that impact and influence health. Now, I know that future career prospects, it will be an important consideration in your mind when you make the decision to choose a university. So do faculty members like us in the school. We are utmost concerned with the future career prospects of our students. We have the internship course, Public Health Practice, which is a capstone course under our second major program, as well as this is offered as an elective course under the minor program. And basically, this course introduces students to the public health infrastructure and functions in Singapore, as well as, very importantly, provide hands-on exposure and internship opportunity by way of attachment at selected public health agencies, organizations. And some of these organizations I've listed, these are actually the employers of our students. Then this course allows students to explore career opportunities in public health, develop the key related essential skills they are needed in their work, specifically soft skills such as management of resources, intrapersonal relationships, communication, advocacy, to provide the practical exposure, right, for public health careers. So these are the feedback from the course itself. Has seen from the feedback, students appreciate the hands-on exposure, which allows them to translate what they have learned from the classroom to the real-world setting, because that's where they also get to meet the public health professional experts from different fields. With that, I have come to the end of my presentation. I hope that this talk has given you a clearer idea of what is public health, and I hope to see you in NUS one day enroll in our educational program. Thank you and all the best. I shall now hand over the time back to our host, Danesh, please. Thank you.
Thanks, Dr. Raymond. So now I'm supposed to share my experience as an alumnus. I graduated in 2021, and I'll share a bit more about that. I think my focus will be largely on the minor program, what motivated me to do it, and a bit about why I moved into doing the master's and how that has kind of benefited me in the different works that I'm doing. Let me just share my screen if that's okay. Okay, yeah. Hello. So just yeah, so about me, I'll keep this short and direct. My undergraduate education, I'm a graduate student, so I'm doing my master's now at the school, and I'm a research assistant with Raina at the Courage Lab. My undergraduate education was in the Bachelor of Life Sciences, and I did a minor in public health. Professionally, I've kind of moved across a few areas. I started in the policy space of the Ministry of Manpower during COVID, doing mental health and suicide policies for migrant workers. I then spent a bit of time in the Tan Tock Seng Hospital, doing some partnerships and population health related work. And eventually I came back to the School of Public Health, which has now been about 2 years with the Courage Lab. And now I'm a master's student. So I was told to share with you all my motivation for doing a minor. And to be very honest, so I'm going to just tell you my raw thoughts because I don't need to be very tactful, I think, compared to everyone else. But I actually didn't really have a motivation. I didn't even know there was I'm not as enlightened as all of you. I didn't know there was a open house. I didn't know there's a public health program. I just stumbled across it because one of my friends was going for the module. I needed to find an elective, and I just followed her and ended up taking one of the courses. It turns out it was enjoyable, it was good, and then I took another minor, which was on policies and systems, and it's actually taught by Prof. Jackie Singh, who was the first dean of the school and the founding dean. And actually, that was kind of what made me interested in public health because it kind of exposed me to, as everyone has shared, as Reina and Dr. Raymond have shared, it's this idea of public health as a space that is very interdisciplinary. It cuts across different fields. It goes into the sciences, it goes into the arts, and you bring your different disciplines into it. But because of its breadth, it also includes complexity. And with complexity means you can bring in different ideas and thoughts. And I found that very interesting because I was very engaged by the idea of looking at complex topics and then being able to integrate both the sciences and the arts. So that's kind of how I fell into the minor of public health. And then after that, I started taking more and more modules to finish my elective. And eventually I ended up with a minor in public health, not planned at all. But I think when I look back on it, there were a few takeaways that came out of it that was really good. I think the first is that it reunited my passion for impact work. I think impact's a very ambiguous term. But when I finished my national service, I was actually a bit disillusioned that you can do work that, especially in Singapore, pushes systems and pushes policies to make it more equitable and more, socially fair for different people and different communities that are affected, right? And I was a bit disillusioned. But when I joined the school, I think in working with Prof. Jackie Singh on some projects, and especially working with Verena, I think I started to see the avenues in how we can drive change, right? How do we drive impact and change in a way that not just vulnerable communities, but broader systems are fairer for other people? And I think in that work and doing work with Verena on sexual health and HIV related work, and eventually as time went on, doing other pieces of work on mental health and suicide, I started to see that that role and that space that was there. And I think that's what it drove that passion again. In terms of career development, I think there was a lot of opportunity to work with different professors. Actually, I think one thing I kind of regret was staying in the research domain quite a bit. I think Dr. Raymond shared that you can go and do these applied internships. And I think those are really useful to see how it's done in the real world. And it doesn't just have to be in ministries. I think you can go with places like Access Consulting and other industries that are opening up as well. But the opportunity to work with these professors, the opportunity to do my final internship with them, that really helped me kind of gain more exposure and it actually gave me job opportunities because in my final internship, I met someone who was actually the deputy director of the Ministry of Manpower at that time, and she was looking for someone to fill that role. And so by chance, I ended up, applying for it, going through the interviews and joining them. And that was a really great opportunity because I wouldn't have met that person. So it opens doors, it opens avenues. The third thing is networks. I do think like if you play a role, I think a minor in progress, especially as an undergraduate, allows you to meet a lot of people. I think the School of Public Health, one of the most interesting things about it is I think a lot of the professors are very generous with their time. And they're very generous in connecting you with people and giving you their time and mentorship and advice as well as opportunities to meet others. So I think that helped. And this picture here you see is a dinner hosted by Prof. Jackie Singh, and there was a bunch of people who are professors or kind of PhD students or public health practitioners or doctors in the field. So that was really nice to be able to meet more and more different people in the space. And lastly, lifelong mentors. As Reina said, I met him in in our undergraduate module, and since then he's always been there, kind of guiding me through different phases of my journey in public health. But not just Reina, I think there are quite a few others. I'm actually meeting a few people. I have a interview coming out, and a few of these professors have been very kind to sit down with me and kind of give me their advice and their expertise. Right, I think that's something that I found to be very unique and generous about the school and how they offer that and they contribute towards that. So even as an undergraduate, they're very willing to support and guide people. So now I just want to kind of jump into a bit about my experience, my work experience, and how that led me to doing a master's in public health. And I'll just be very direct about that. So in 2021, as I said, I joined the Ministry of Manpower. I became a policy officer and was leading the building of a mental health ecosystem and suicide prevention policies for migrant workers. As you know, that was the height of the pandemic. There was a lot of lockdown measures and high levels of mental health and suicide amongst that community, and we didn't really have anything in place at that time. So I was there trying to help build it, and it was really interesting experience. I think it actually helped me build my interest and passion in migration related work on migrant health as well, which I've continued. But when I look back at it towards the minor, as I said, I heard about the role from there, but I think it also positioned me as a better candidate. At that time, I think I was working with Verena on a couple of pieces on mental health, and I also had some skills in public health, which then kind of allowed me to, very utilitarian point of view, position yourself that you're the best candidate with your CV and allow you to get that role, right? But the truth is, and I think I'm not sure I should say this because the minor in public health, I think most of you here are trying to apply for the minor, but I did still feel, in spite of having the skills needed, that there was a lack of like the in-depth skill sets. And I remember when I was kind of designing a policy for MOM on migrant worker mental health, I was supposed to evaluate the entire ecosystem. And at times I felt quite out of that because I wasn't formally trained in qualitative research in public health, nor was I trained in quantitative research. I didn't really have experience in program design evaluation, which was some of the stuff that I was doing at that time. And so it was quite hard to kind of pick those up. I think like, yes, you can read a lot, you can ask a lot of people, but sometimes getting that training and that tangible skill set is really important. And that's how I kind of decided, okay, you know what, I want to build these skills. And going back into the master's program, going into that depth and rigor of it that you're taught and being able to apply it, that was what I wanted to gain out of it. And that's why I kind of decided to shift back to the master's and what I feel was actually useful. And now when I look back at the masters, actually a lot of the skills are quite useful. So just to share, this is a critical care fund for migrant workers. It's a ground up that myself and a few others started to support the access and affordability of treatment for migrant workers with critical illness in Singapore. So we largely fund their treatment, but we're also working towards advocating for a kind of insurance solution as well as a policy solution. And as Reina said, we do a lot of that, right? Using health and data to drive that. So it started in 2024, and as I said, it's a critical illness, so it is a public health issue. And a lot of workers face disparities in how they receive treatment. They're repatriated or they face challenges. And I think when I look back on it, the benefits of my master's, even in this role, was that it gives me a lot of in-depth data analysis skills. It allows me to kind of translate evidence and kind of use that evidence and the quantitative and qualitative experts to drive our research for this community, as well as then drive our policy kind of analysis and advocacy as well, right? And there's some very tangible policy analysis and advocacy skills that we gain from our master's program in terms of health communications, how you write an advocacy piece, how do you analyze policies and present it as well. And I think the last thing is the credibility of the masters. I actually remember when I was talking to a funder in funding our ground up, like when we were sitting there with them, I think they said, so what are your backgrounds? Like, what do you offer? And I think my other one of the founding team members said, oh, actually, he has a master's in public health. And I think that kind of made them like think, okay, yeah, these people are actually quite credible. They don't just come in here and trying to push for something. They actually understand it and they have that kind of depth of knowledge. Not that you always have to have that, but I think it does help. Um, sorry. And the second thing I just want to share is about the Courage Lab. I think Reina has gone into a lot of this, and I don't really want to touch too much, but maybe going into our projects. A lot of our projects have been, or at least the ones that I've worked on, which I've listed here and is not exhaustive, has either been a lot on translational research, looking at health equity, looking at health systems, and also like global health policies with some of our mental health and HIV work, or has been primary research on suicide and migration. And a lot of those skills didn't really come very intuitively. I had to kind of pick it up. And I actually think the master's program helped a lot because I then started to apply those research skills in a more thorough manner. And if you can see here, actually a lot of the work we do in Reina's lab is actually quite social science, more sociology based, and I'm a life science person. So actually I'm quite like a fake because like I have to pick this up on my own and I don't really have a background in that. But I think that's the beauty of like the public health as well. You can kind of transition and be able to pick those skills up. And besides the research skills, I think a lot of times when you're in a master's program, you develop new projects. You also learn theories and methods that can actually be applied with your professors and group members. And you can also learn how to kind of clearly translate scope problems and translate them into real world outcomes and programs as well. So from my professional experience, I felt that the master's has helped on those fronts. Broadly, I think what I would categorize it into is three categories. One is that the master's offers practical skill sets. So you get tangible skills in program design, evaluation, quantitative and qualitative analysis. There's more and more programs coming out. There's some stuff on like urban outbreak assessments and some geospatial stuff as well, which is quite fascinating. And they're very much applicable to the real world setting. So the Masters of Public Health is a practitioner-based master's, and it's about applying it to the real world setting, taught by practitioners in the field who actually use it. The second category is relationships and networks. My classmates are quite diverse across the health sector and also across the region. Some of my close friends are actually from my master's program from the Philippines, Hong Kong, and actually other parts like Malaysia. And they're doing some interesting work, and you're able to connect with these people. And it really does help having these networks across the spaces, not just in terms of collaborations, but also in terms of future career prospects as well. The other thing is your relationships with the professors, and I think that really does open doors. I truly believe that. I think a lot of them do help you find opportunities as well. And lastly, as I said, I think having the MPH does allow you to hold a bit more weight in how you position yourself and you put it across, especially in more specific sectors as well. Yeah. So just to end, I think like I am a health equities person. So I think one of the things I like to talk about is this idea of health. And I think a lot of times when we look at health, we often think of it in the disease or the illness. But actually, the truth is when it comes to public health and health in general, actually health is just a final presentation of systemic inequities upstream. It's actually a revealer of things that perhaps are presented as illnesses, but actually upstream issues that the system needs to figure out and fix. And I think with that also comes this interdisciplinary, cross-sectorial kind of opportunity to explore things. So if you see Rena, he's a sociologist. If you see other people, they come from disciplines such as psychology, some are clinical medicine doctors, but some are political scientists. And I think that cross of different fields allows you to address these issues upstream. And why public health is so fascinating is, as I said, interdisciplinary in nature. It's a malleable field. I think it's evolving a lot. People are bringing in their own experiences, they're bringing in their own fields and thoughts, and it allows that room for that because it's so broad. I think there is a tangible and meaningful impact. Especially depending on where you work, I like to work in a space of being on the ground more. I don't like being stuck to a specific desk and being closer to the communities, and I find impact in that. It's complex and dynamic because it's so broad. You're dealing with issues at systems and policy level at times, and that requires kind of complexity and kind of shifting and adapting to different things and understanding different concepts and integrating them. And I do think there's diverse career opportunities. I thought Dr. Raymond shared quite a few, but actually there's even more opening up. I think the philanthropic space is quite a big one that's coming in as well. And I don't think you need to stay in health. Like there's a lot of transition between health and social issues as well. So there's a lot of that interconnectedness. And yeah, I mean, as I said, you can be on the ground, you can be at a desk. It's quite blended. So yeah, with that, I'm just gonna end it here. If you have any questions, you have the Q&A, or you can reach out to me on LinkedIn or my email here. So thanks very much. And yeah, I will continue as the MC and I think they will take over the slides. Yes. Okay, great. Yeah, so that's the end of my sharing. I am now going to pass the time to the last sharing of the day, which is from two current students who did during their minor. I think they are more recent. I'm quite a seasoned or aged or whatever you want to call it, but they will probably be able to share with you more about their experience. So there is Daniel Chong, who's a year three life science student, and Tam Jiasi, a year two business student. They're both members of the Public Health Club and they're serving as the eighth executive committee. So Daniel will share his perspective in taking the second major in public health, followed by Jiasi, who is doing a minor in public health. So over to you, Daniel, whenever you're ready.
Thanks, Danish. Yeah. Hi everyone. Thanks for taking the time to join this sharing. And let me take a moment to share my screen. Yep. So what Danish mentioned, I am Daniel and I'll be sharing some of my perspectives and experiences with the second major in public health curriculum. So these are things I'll be covering today. Firstly, it's about my experiences in the undergraduate program, followed by how it's complemented my major, and then as well as like as a current undergraduate student, what are the future career pathways or goals that are sort of more immediate after graduating from the program. So firstly, a few things about me. Like what Dash mentioned, I'm a year three undergraduate student, major in life sciences, second major in public health, and then specializing in biomedical sciences. In terms of my public health curriculum, I've almost completed my second major in public health. So I've completed 6 core courses and 3 elective courses. And then beyond academics, I was also involved in various other activities, like what Reina and Danesh mentioned. I was an RA since year 1, Sem 1. And then I've been research director of Public Health Club since year 1, Sem 2, and then president of Public Health Club since then. And then as for a brief introduction of public health, social public health courses. Generally the size classes are quite small to moderate class sizes. So for the core classes at least, it's about like 60 to 70 people. And then when you move towards the elective classes, you go to about 15 to 20 people. So this in contrast to general faculty or major classes, which are typically, generally speaking, about like a few hundred plus people. And as a result of the small class sizes, there is a lot of interaction between teaching staff and students. And then one key thing about the whole class in system in school of public health is that actually there's a lot of group projects here. So really one of the fundamental goals of the curriculum is to allow students to be able to interact with each other and then to really learn how to work together in a group, which is why like there's a lot of group projects within the classes as well. And then there's also significant moderation based on the peer review. In terms of class coverage, there's actually a wide range of technical expertise from coding to qualitative research. So I think like typically when you go into like the common or core classes, it's more fundamentals, and then when you go into electives, it's about it's about specialized skill sets. Yeah, so actually beyond the classes, We also have research opportunities. So some professors may have opportunities for students. And then for myself, I've been involved in reviews, research, data analysis, and economic modeling. And then I've also been able to present in various conferences, prepare reports and papers. As for student life, Public Health Club is also a student life, I would say an interest group, but an initiative where students can get together beyond the classes lah. So it's separate from the curriculum. So in terms of how I complemented my major, really like for biomedical sciences for people who are aware, it's mostly focusing on a molecular level as well as the individual level. So you learn how things happen at a physiological level, and then really looking at the mechanisms behind it. And then it mostly features wet lab research. And that was when I wanted to see how it was being implemented in a wider scale, which is where I went into the second major curriculum, where I wanted to see how these knowledge and findings are being translated into actual practice on the ground. And then as well as how to implement all of these within communities. So I think like what everyone mentioned already, that it's not really about the knowledge itself only, or it's not only about the intervention itself, but also about how it interacts within society in general, which is where I went into public health to sort of get the understanding and then to pursue the understanding better. Yes, and then of course with public health comes with a lot of dry lab research and then the ability to explore field. My field is biomedical sciences, but then a lot of my work has been around psychology and sociology. So in terms of future careers, first and foremost, I think it will be postgraduate studies. So medicine for those who might be interested in postgraduate medicine, that's an option as well. And then if you're interested in research, there's a PhD in public health, also provided by the School of Public Health. And then if you want to learn how to practice public health, it'll be the Masters in Public Health or Doctorate in Public Health programs. And then there's also consulting available as well, where companies might hire you for drug regulatory things, and then non-profits who are interested in helping enhance their programs and to implement their programs. And then finally, public health service, which actually Dr. Raymond covered more in depth. That really you have statutory boards and healthcare clusters that also hire public health professionals to really look at how to improve community care and preventive care. I think that's it for my presentation. And then I'll pass the time back to Jesse or the host.
Yeah, hi. Um, Sorry, do I need to share my screen instead, or
Yeah, Jesse, I think you can just share your screen with
okay,
your
hold
slide.
on.
Oh, Jesse, we have already shared your screen. You can just proceed. Thank you.
I'm not able to see it on my end though. But I'm just gonna assume that it has been shared already. Okay, can. Yeah, there we go. Yeah. Hi everyone, I'm Jiaxi, a year two business student. I'll be sharing my experiences in taking public health as a minor. So my mod list will be a bit shorter. I'll be sharing about the mods that I've taken, but I won't be doing as many mods as Daniel, since minor is 20 MCs and Daniel's one is for major it's 40 MCs. Yeah, okay, next slide. So I'm a year two business student that's specializing in business analytics, and then second major in finance. Then I decided to take a minor in public health. So um, many of the mods I wanted to take this sem, which is year two, sem two, were actually rejected. So even until like round three. So instead of furthering my majors, I decided to clear my public health minor this semester. I only started taking public health mods during my year two, sem one. And during year one, I was mostly clearing out my GE mods and clearing other core business mods. I'm not too sure what goes on regarding mod bidding for other faculties, but the pre-assigned mods for business was quite hectic, so it was quite difficult to plan ahead since it keep on overlapping with other things that I've originally planned for. Yeah. Next slide. So why I decided to take public health as a minor, it originally started out because I was accepted into the public health club. Because for business students, we all need SCP points. So a bit of a shameless plug, but currently I'm a welfare director of the club, and anyone who's interested in joining, also do let either me or Daniel know. Yeah. I kept my eyes and options open, yes, when when I joined, since I wasn't really decided even until today actually on what job and what field I wanted to get into even after I graduate. So being in the public health club ended up giving me or getting me interested enough to do a minor in it. So for business students, if there are any, SEP is basically points needed to increase your likelihood of going overseas for exchange if you ever want to do that. So the weightage mostly comes from your academics, but volunteering, CCA, and other related uh, things can also contribute to that significantly. Yeah, next slide. So relating to the public health minor, I've taken three courses this sem and then taken two courses last sem. So the courses taken are 2002, 3403, and then there's one that's a bit of an outlier, which is DAO 2702. That one is a mod that overlaps with my current business mod, so it can double count. And then 2001 and 3402, which is on mental health this semester. So okay, the main thing is I wanted to just tell everyone to kind of do your own research beforehand. My biggest regret as of now was also not doing the GE mod that Dr. Raymond mentioned just now, because that one can double count towards your GEC, GEC 1015, yeah, Public Health in Action. But also, hearsay, it was a bit more difficult than a typical level 1 GE mod. So yeah, in terms of things like class sizes and all that, is a bit smaller for the level 3 mods, and then for the level 2 mods, it's a larger cohort size, about like 70-ish students, about there lah. Yeah. But the main thing to note is that for all these SPH mods that have uh, group work, there will always be a peer evaluation that would affect your grades quite significantly. So do have a good work ethic if you do intend to take any of these mods that have group projects. Yeah, and for SPH 2002 and 2001, they both have, and they're core mods, so just take note of that. Yeah, so going into the rest of them, 3403 on public health economics. First semester is on economics, then the later on is on models, which is quite different, but it's still very interesting nonetheless. For DAO 2702, as I mentioned, it's on Python. That's mainly a business core module. It's quite difficult. I'm currently still kind of struggling on it lah. But unless you have prior experiences in Python or in coding, I think it's going to be a bit of a task, uphill challenge. Yeah. And then lastly, the for SPH 3402 on mental health, I took it out of interest, and it was quite an interesting change of pace because it was something more qualitative rather than quantitative. Yeah, okay. Next slide, last slide, and I'll wrap it up. Yeah, so I was looking at why I wanted to take a public health minor, and at the end of the day, I kind of concluded that I wanted to take instead of your typical business student doing jobs at banks or big data related companies like Shopee or TikTok, that kind of thing, right? I wanted to find internships such as places like pharmaceutical companies or other healthcare related companies that are not very, very heavily reliant on AI. Yeah, the main thing, I'm still a bit scared of this big word AI that everyone also isn't too sure of what to expect. Yeah, so taking public health as a minor has currently allowed me to view things in a bit more of a zoomed out perspective, such as considering the socio-economic impacts of certain policies, if they were to be implemented, rather than a lot of the like nitty-gritty down on the ground details. Although that's important too, don't get me wrong. Yeah, so some might like the researching aspect of public health, but for me, I wanted to make use of that, the data. So stuff like SPH 2001 focuses on data. Yeah, to use those data to understand them and to predict certain changes or to make the best of anything that was given to me. Yeah. Yeah. Thank you.
All right. Thanks, Daniel and Jesse. So we're gonna have some Q&A. We have the Q&A segment now, and I'll be moderating this session. So please submit your questions via the Q&A, or you can just raise your hand and um, you know, raise the question and unmute yourself. I think that will work as well. Yeah. Um, or Dr. Raymond, do you have any particular questions that you would like to answer? We
Yes,
do.
I think
Okay.
I believe we have tried to answer the questions already via the Q&A type out function. If any of you would like to raise any further questions, follow-up questions and all this, please feel free to raise your hand, or if you have any new questions, new additional question, please you're welcome to again type in your question at the Q&A function. Yeah.
Yeah, I think So for those of you who are maybe looking at the master's program, we're happy to probably what we'll do is we'll end the session and we can keep this on. And if you have any other further questions, you can ask us directly. But maybe more towards the undergrads and minors. Yeah, if you can just raise your questions now. Yeah, and I know some of you are interested in the masters. I'm happy to chat with you after that. Yeah. Okay. It seems pretty quiet on the front of questions. I think what we'll do is, so if you have any further questions, you can always drop us an email or you can contact us and we can respond. But with that, I think since we've reached the 6:05 timing, we will probably move to end the Q&A session. So thank you everyone again for being here with us. So we do have a live, a physical open house. So if you're interested, you can drop by our booth at the College of Alice and Peter Tan in Newtown at the multipurpose hall this Saturday to find out more about what we have to offer, as well as to grab some freebies. So the school and the volunteers will be there from 9 a.m. to 5 p.m. And Associate Professor Liao Qixiang, who is the Vice Dean of Education, will also be conducting a talk on why public health at Stephen Riadi Level 1 Global Learning Room. So there'll be two sessions from 11 a.m. to 12 p.m. and then a second session from 1 p.m. to 2 p.m. Yeah. I believe the slide should be okay. You will see it appear in a minute. Yes, so that's the talk, and that's Prof. Chi there. And lastly, if you wish to learn more about the school and the programs we offer, in the next slide, you're going to see a QR code on the screen right now. And our social media accounts are also featured on this page, so you can give us a follow. And if you have any more questions, as you can see on the bottom right, you can always send it through the inquiry form over there, so you can scan that QR code. So just going to leave it here for anyone who's interested. Okay, and I think with that, we're going to end the session for today, and we hope you have a lovely day. Thank you for joining us. And for those of you who maybe have any further questions, you can always stay behind to ask, especially for those interested in master's program. Thanks very much, everyone. See you.